Hi, my name is Jenna. This is my Module 4 assignment for Pharmacology. So I'll start with this scenario. The Emergency Medical Services team has brought a 54-year-old female patient to the emergency department where I am working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 from her cell phone. After the woman screamed obscenities at her and then fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell stale body odor and urine. So for the critical thinking questions, just based off my first impression of the patient's actions and appearance, I had come to the conclusion that she could be suffering from schizophrenia and possibly alcohol addiction. Schizophrenia is characterized by thoughts or experiences that seem out of touch with reality. It is a very serious mental illness that interferes with a person's ability to think clearly, manage emotions, make decisions, and relate to others. This could explain the disoriented and combative state of mind that the patient was in and why she was accusing the EMS team of stealing her purse. When it comes to the patient's hand shaking, a sign of alcohol abuse can include tremors, and it could also explain why she was being so aggressive and shouting at the doctors and nurses that she needs a bottle. There's not too much information given on the patient, but that would be my initial thought until we could assess her and give her a true diagnosis. So some short-term health risks that this patient may face include hygiene problems, possible UTIs or skin infections from when she is wandering around and how she fell and scraped her arm and face. Long-term effects could include homelessness, anxiety, depression, dangerous behaviors, substance abuse or addictions, or even possible death. Assessments that would be needed for this patient would include a mental status examination, a physical examination to make sure she was not injured other than the scrapes on her arms and face, and then her blood pressure and her heart rate should be checked to make sure they're in the normal range. Lab test like a basic CBC, drug test, urine routine, liver and renal function test, and a CT scan of her head to make sure there is no trauma to the brain that could also be causing erratic behavior. So for the research question, mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed, and the support of insurance, is it sufficient? So mental illness management does include both pharmacological and other therapeutic methods for treatment. Psychotherapy is the therapeutic treatment of mental illness provided by a trained mental health professional. Psychotherapy explores thoughts, feelings, and behaviors and seeks to improve an individual's well-being. Psychotherapy paired with medication is the most effective way to promote recovery. Treatments can include hospitalization, support groups, therapies, cognitive behavioral therapy, which focuses on changing the automatic negative thoughts that can contribute to and worsen emotional difficulties, depression, and anxiety. Exposure therapy involves exposing the target patient to the anxiety source or its context without the intention of causing any danger. Dialectical behavior therapy, which is another type of cognitive behavioral therapy, this tries to identify and change the negative thinking patterns and push for positive behavioral changes. The types of medications that can be used are antidepressants or mood stabilizers. When it comes to insurance, one of the most important provisions of the Mental Health Care Act 2017 in Section 21 is the inclusion of mental illness for health insurance coverage. This is a progressive step towards considering mental illness as the same importance with physical illness. This will then allow better access to mental health care. Mental illness can be a lifelong affair, and it is extremely important to treat So since it is a lifelong affair, that can also mean that any medications and therapeutic methods will also be. This is why it is very crucial that there is health insurance that covers mental illness, that is available to help cover or lower prices of the treatments, hospitalizations, or medications. That way it is accessible to everybody who needs it, in turn helping them get better.